I was fortunate enough to get the East Research Scholarship several years ago, and was able to use that money to fund a clinical trial. We actually were able to do a randomized control trial. It was multi-institutional. We recruited about 30 patients and injected some of those patients with open abdomen with Botox and some with placebo. And this was back in the days when open abdomens were a much more major ordeal for us as trauma surgeons, and that we needed better ways of closing these patients, or else they would have long-term hernias. Um, the Botox didn't help. It was a negative study, but we were able to go through the funding mechanism and get the question answered. So the way the scholarship helped me grow as a trauma surgeon and as a researcher was it allowed me to really know that I could do the things that I wanted to do, that I had some of the skill sets to be able to do it, and gave me the experience really that I was lacking at the time, to know how to conduct a clinical trial, to know how to network and reach out to these sites and figure out what was needed in order to be able to participate in the study. And then, of course, going through the analysis and the design of the study and all those types of things. So it really kind of broadened my horizons, and gave me the confidence and the knowledge to be able to go further.